and it's got some caloric value to make the patient a little better. It's pretty acidic, but it will provide a bit of, it will provide pure water. It's a way to get pretty much pure water into a vein, because the dextrose makes it tolerable to put it in, and then the dextrose is metabolized, and so you end up with just free water. So it's got some benefits, not used a lot. And it's, you can see I've made a little note that dextrose is limited in its use because it doesn't have any electrolytes. But it gets some water. It'll take care of water loss. And it's also good for patients that have low blood sugar, diabetes type problem. There's one more, and that's the hypertonic saline injection. It's become very popular in recent years, and the idea is that you give this really hypertonic, in other words, it's got way too much salt in it. You give hypertonic saline injection. What's going to happen? Oh, well, you're going to send the body into a crisis state, but temporarily what will happen is the cells of the body will release water that will go into the bloodstream and expand the bloodstream. So for a patient that has very low blood pressure due to blood loss, due to shock, one of the treatments that has been popular is to give this hypertonic saline injection. The osmolality, look at the osmolality, it's 2,464. So it's got way, way too much osmolarity. The pH is low. Don't worry about that because you're just trying to save the life of the patient. Okay, so you give this. Well, now you're sucking all the water out of the cells. Now the cells are put at jeopardy. And so it turns out that, yeah, you can do this for a little bit, but you've got to be able to get it back towards normal as quickly as possible. So you've got to start giving saline to get things straightened out. Okay, when you use it, the only one indication for use is shock, increase osmolarity, and you're getting the water. I explained that. And the effect is temporary. That's all it does. Won't do things for too long. Okay, let's change gears here and talk about practical fluid therapy. I told you we we're going to do something that you could use today. And I'm going to tell you about the problem at the University of Pennsylvania back lots of years ago, I guess I could say. Two things happened. One is that we changed the protocol for putting in IV catheters and decided what we were going to do is put these catheters in and then put big bandages around the necks of the patients and never look at them again, in essence, because we had all this expensive bandage on the outside hiding the catheter. And the other thing that we were doing is we were letting students put in these catheters, and we were letting veterinarians put in the catheters, and we were getting into serious problems. One more thing that was happening was that in the wisdom of some folks, they decided that what they would do is take 1-liter glass containers of fluids, take the caps off, and pour the fluids into big 5-gallon carboys. And then they'd put the cover on that carboy, but they couldn't screw it down tight or the fluids wouldn't come out, so they kind of left it so the air could get out or get in that was in the stalls of these horses. And then they'd hoist these carboys up to the top of the stall and run the fluids intravenously. Well, dust and dirt is at the ceiling of most horse stalls, and so the dust and dirt was getting into the fluids, and when they were taking it from the glass bottles and putting it into the plastic carboy, they were splashing it all over and getting a bunch of bacteria to go in that way. And then in the summertime, when it was really hot, even though it was supposed to be sterile fluid, they were getting it contaminated and growing bacteria. And so we had a multi-big problem because of the way the catheters were being put in different ways, and then beyond that, putting in these non-sterile solutions. So what did we do, and what do you want to think about? First is that as your importance in veterinary medicine has become so obvious, one of the things that you do and one of your important roles is to insert and maintain IV catheters. You do that. You're doing that in the stall bases, and you're doing it in the back room where the cages are, and you're taking care of it. The veterinarian probably doesn't even walk back there. And so the question is, have you carefully considered what it takes to prevent complications in this form? And here's what we found. You technicians, you folks, have to insist that there be a policy and a protocol for inserting, maintaining, and giving, or the catheters, and then the giving of the fluids. You need a written protocol, and you've got to insist that everybody at your facility do it the way it's been agreed upon. If you don't, you're going to end up with these three things happening. And phlebitis, you probably know, is an inflammation of the vein where that catheter, near where the catheter has been put in. Then there's thrombophlebitis, which means you've got phlebitis, which is the inflammation, but beyond that, you've got a blood clot. So you've got it clotted now. So now you've got really a beginning mess on your hands. And then the third is septic thrombophlebitis. What does that mean? It means that now you've got inflammation, you've got a clot, and the clot is now infected with bacteria, and so you've got septic thrombophlebitis. And at the University of Pennsylvania, there was a period of time that we were saving horses from with colic, with terrible diseases within their abdomen, and losing the horses because of the protocol we were using to manage and give fluids. And it was just tragic to call an owner and tell them, yeah, the surgery went fantastic, but your horse died because the vein got infected. It was just unbelievable. So we had to stop and say, what are we doing wrong, and how can we fix it? And what we found is that there was a failure to follow the protocol for inserting the catheters. It has to be the same every time. And if you do it that way and have what's called best practices for insertion and maintenance, if things change, you can find out, has there been a change in the way you've done it? Or if your technique isn't the best, you can make a change. You can have a meeting, make a change, and say, from now on, we're going to try this. And if it goes away, you got it solved. But you can't have everybody doing it in a different way and expect things to work out. It's just not going to happen. And so retraining, reinforcing, need for all the hospital personnel to do it the right way. And if you've watched, and probably you verify this for me, the veterinarians there are probably the sloppiest. They don't want to follow protocol. They're just in a hurry. They want to do it and get it done, and they make mistakes, mistakes that cause problems. So you kind of keep them out of it. It was, I don't know what it is now, as I've retired, but I can tell you that veterinarians were forbidden from putting in an IV catheter at our facility because they wouldn't follow the rules. They wouldn't follow the protocol. And so it was a technician thing, and we couldn't let students do it anymore, and we had to depend on them. And one of the things, as soon as we did that, the problems went away. And as a beginning, just to give you, we went to the local best human hospital and took the course. All the technicians went there and learned how to do it as a human hospital did, and brought those concepts home, wrote up the protocol, and said, this is the way we're going to do it from now on. And then finally, you got to correct any problems immediately. As soon as you see them, you got to fix it up. Okay, I just want to put a couple pictures in there for you. These were what these veins looked like in our horses that were being infected. I mean, this is the one on the right. That vein is probably 3 or 4 inches across, and these are ones that I had to take